I would describe the behavioral health system in New Mexico as very much broken. There's not enough quality licensed providers to deal with the massive numbers of people that are on Medicare and Medicaid.
Main things I noticed was psychiatrists would just hand me drugs. I'd be a month on this med, and then a month on another med, and a month on another med, and just changing.
New Mexico's system is in crisis. They have reduced the number of intense outpatient treatment. Some individuals really need that level of care.
There are a lack of services and a lack of programs really in rural areas.
When students come into our school-based health center, they can only really be seen by us if they have a diagnosis. What really kids need at that age is to be able to make friends with someone in the school, like our therapists, that they can stop in and talk to when they're having bullying instances or something going in their lives. We're not able to do that in our school-based health centers.
I don't think it's useful to just incarcerate youth, because then they get used to that type of system. And then you're going to start believing that you're no good. You're going to start believing that you're a criminal.
So I would describe New Mexico's behavioral health system of care as really being full of holes. Several years ago, I saw a presentation by Healing Addiction in our community, and they came to a meeting that I was at and talked about this really epidemic of heroin abuse among young people in this community. What these parents all said was, when I found out that my son, my daughter had an addiction and was willing to get treatment, there was nowhere to go.
We need to make sure as a state, as individuals, to vote for politicians that are interested in these things, and also vote for funds to cover these different types of programs that are vital.
The Department of Education really, need to work hand in hand with like the Department of Health or Human Services Department to really see how we can utilize the behavioral health that's there to help students improve in their learning.
To empower us to invest the money into the future of youth instead of just the punishment of youth. That's what La Placita does, and they'll stick with you. Like, once you go La Placita, like, you always find yourself coming back.
People don't get their treatment, they're going to end up in jail or they're going to end up being hospitalized. We need a strong outpatient system.
So I think one thing that needs to be orchestrated in the behavioral health industry is well-grounded employees or specialists who don't plan on going anywhere for a while, who aren't always jumping from one job to another.
Our governor can sign an executive order to say, okay, LMFTs can now accept Medicare insurance, and that would open up a whole new group of people that could then see the people.
A functional, healthy behavioral health system would be a system where someone who is struggling either with mental illness, with an addiction, or a co-occurring disorder would be able to pick up the phone and have a resource that could find them the treatment that they need. All of the wraparound services that they need to get healthy and stay healthy. We need to have a very collaborative approach and begin funding some of these priority services.